morning. Let's do a little sound check here. Okay, sound check, testing, testing, testing. Okay, looks everything okay. So today is Saturday. This is our regular Saturday morning yoga therapy class. And as I always say, this class is based on our own experience, primarily teaching to the participants, which we used to be in person before this pandemic. Today's topic is yoga therapy, whole person's approach to health. And as you know, all of you, what I said at the beginning, that we have our daily practices, and how do we incorporate daily practices based on the situation or make an adaptation of our philosophy of yoga, practice of the 8 limbs yoga to incorporate as a yoga therapy. So today, before I start, let me just mention to you the few concepts, or maybe a few names, acronyms with its proper meaning, a proper definition. First, yoga therapy is the adaptation of the practice of yoga based on the patient's clinical condition. Very simple. Practice of yoga is a philosophy, 196 sutras or small aphorisms, 193 of them to quiet down your mind. Practice is the 8 limbs: yam, social restraint; niyam, personal restraint; asana, external and internal alignment; pranayama, voluntary regulated breathing; pratyahara, control of your 5 senses; dharan, focus; dhyan, meditation; samadhi, union of your body, mind and spirit. Practice of yoga was designed for self-realization. But during the practice, we have a lot of health benefits which we're using as an adjunct therapy for our underlying chronic lifestyle related disorders. So health is the outcome of a regular practice of yoga. Especially regular means daily practice. It's a daily routine. It's a dinacharya. Health is defined in yoga as a balance of your body, mind and spirit. And the whole person approach, whole person is the existence in a body, mind and spirit. So the balance of the body, which we do all the time, is the balancing poses and primarily activating both sides of our brain. For example, if I'm right-handed, I'm using left hand for most of my day-to-day activities to make my other side of the brain more functional. Imbalance is the root cause of our chronic lifestyle related disorders. Simply, as I said, I always brush my teeth with my left hand, and I'm practicing for a long time, so I have no problem brushing now. But initially you have a problem. Initially, say the brush will be all over, and then by the time you start doing it, your right hand will be moving, because that's called neuroplasticity. But slowly and slowly that will go away. Then you'll see when you are not brushing with your left hand, you feel a little bit of a discomfort. Same way, I'm going to clean my table or my surface. I have a rag in my hand. I hold it in my left hand. I clean with my left hand. I do the balancing poses more on the non-dominant side. In a pranayama practice, we do alternate nostril breathing. Left nostril is controlled by the right brain, and right nostril is controlled by the left brain, activating both sides of the brain. So the balancing both sides of the brain and balancing equally, like we do a, say, Gomukhasana, cow face. When you put the hands in the back and do that on the other side, you will see that you have a little discomfort in one side than the other. But when both sides are equal and you are comfortable, that means both sides of your brain is working and is in balance. For mind keeping in balance, basically in the state of meditation. And as I said, meditation is a state when you enter in between your repeat thought process, which is called a gap, and slowly widen your gap, and you have a control of your repeat thought process, which is called your jumping of your brain or monkey brain. In the state of meditation, your mind, which was like a waterfall, became like a river, became a pond. Now you can even see through that water all the way down to the ground. Basically, balance of the mind is the mindfulness. Mindfulness means you are paying attention to what you are doing, and you are in complete compliance with that action, and maybe even you are merging with that action. I'm cooking. That is my balance of my mind. I'm reading and able to learn how to control your other senses. That means when I'm reading that. I'm able to shut down my other senses. I'm looking at this, I'm reading, but I'm able to shut down my hearing, my smell, my taste. So my brain will be in contact and touch to one sense at a time, which is the fifth limb, pratyahara. Pratyahara. Pratya means reject, ahara means input. So this is very simple. At the level of the body, balancing both sides of your brain. At the level of mind, have a mindfulness throughout the whole day. I'm talking to you, my mind is here talking to you. My mind is nowhere else. Spiritual balance, which we call oneness. That's very important. We have a participant now who is a spiritual leader, who is a spiritual practitioner, spiritual teacher. So you understand, spirituality means a believing a power above me and surrendering. It's a wonderful, wonderful term. The word spirit comes from spiritus. Latin spiritus means your breath. So, the oneness which is being described in spirituality is called non-duality. Non-duality means you come into the state of your spiritual practice where the subject and object are indistinguishable. There is no distinction between subject and object. So I'm doing it's a tree pose with caution, and I'm paying attention to my asana pose. I'm paying attention enough that slowly and slowly I merge with that tree pose and I became like a tree. There is no distinction between me and the tree. That is the non-duality, that is the oneness. So the health is a balance of your body, mind and spirit. So let's look at the practices, what we do to maintain our health. The first maintenance of the health is able to keep your spine straight. The moment you keep your spine straight, you enter into a state of relaxation response. Relaxation response slowly takes you to the phase of parasympathetic activation, which is seen in your physical body with the saliva in your mouth, which I have now. I have a saliva in my mouth. I'm talking to you, so saliva in my mouth. So the most important practice from yogic standpoint, what we have found from our individual practices, able to keep your spine straight, do all the asanas with your spine straight. Here I'm sitting in a kneeling stool with my spine straight. I'll get up in the morning, I'll call it dandasana, put my body against the wall, and I'm in a profound level of relaxation response. Able to sit down in a grounding pose, primarily able to sit down in your squatting pose called malasana, is a sign of health. So in the morning, what we do in the morning, let me show it to you here. Morning, we will be able to sit down in the squatting pose. So if you're practicing with me, try this. It's very important sign of health, especially as a whole person approach to health. So have your feet grounded and your feet and ankle are relaxed, knee is relaxed, hip is relaxed, back is relaxed, whole lower part of the body is relaxed. We get up from the bed in the morning as a person with a health. Generally, we sleep as a yogi on the left side of our body in a fetal position, and when we get up from the bed, we get up from the right side of the bed. A lot of reasons behind it, and I already told you those things during the session on my yoga therapy for sleep. Sit down in a squatting pose, then have a glass of water, preferably in your room temperature, and drink the water in a gulp. One gulp. 2 gulp. 3 gulp. What the gulp does, it initiates the peristalsis, the contraction of your gastrointestinal tract. Your whole gastrointestinal tract is supplied by parasympathetic nerve. When you have a sympathetic overdrive, like when I'm in a stress is nothing but sympathetic overdrive with the sympathetic nervous system in out of balance. And with the gulp when the peristalsis starts, and with the water when the stomach stretches, you also get a gastrocolic reflex, which is your contraction of the colon against a bowel movement. Constipation is the root cause of our ill health, because constipation is a sign of sympathetic overdrive. Parasympathetic activation, you will have a smooth bowel movement. After that, put your hands, separate your fingers. Your hands get relaxed. Extend your wrist gets relaxed. Put your one elbow inside, other elbow inside. Slowly bring your hand close to you. Keep your spine straight. Now close your eyes. Pay attention to your breath. Bring your awareness to your breath. Breathe out first. Take a deep breath in. And breathe out longer than breathing in. Slowly increase the timing of your inhalation and exhalation. Preferably we do 1:2. If you get a 2 second in, 4 second out, 3 second in, 6 second out, We have been doing it for so long, we can easily do 8 seconds in, 16 seconds out without any effort. When you pay attention to your breath, breath is the connector between your body and mind. Your eyes are closed. You are looking at your subtle body. Your whole thought process is in your breath. And you slowly enter into the mental wellness. Physical wellness, mental wellness, and spiritual wellness. Wellness is a state of mind which we carry throughout the whole day. So, when you're able to sit down and you develop this relaxation response, you have a wonderful sign of health. Next, able to get up from here without a support. If you're able to get up slowly all the way high up, then able to get down without a support is a perfect sign of health. Able to sit down in a meditative asanas. What are the meditative asanas? The asanas which has a profound level of relaxation. Asanas which keeps your spine straight, and the asanas which balances both sides of your brain. That is the whole person's approach to health. Physical health, the physical wellness, mental health, mental wellness, spiritual health, spiritual wellness. Able to sit down on a cross-legged, take your both the feet, put it under both the knees. Keep your spine straight. Touch your index finger and thumb. This is your Gyanu Mudra or a Dhanu Mudra, meditation mudra, with the palm facing high up, receiving from the universe. Close your eyes and bring your attention to your breath. Mental health, mental wellness starts from the mindfulness that comes with the paying attention to your breath. Visualize your breath. Visualize your breath coming out from your noses. Breath coming out from your nose. I can clearly visualize the breath is coming out through my nose. Visualizing breath is coming in through my nose. Air is entering through my nose. Air is getting filtered. Nose is like your personal air conditioner. Outside air is warm, it's cooling it down, and outside air is cold, it is warming it up. Visualize the breath coming both sides of your nostril, which is called a turbinate. Air going through the turbinate creates a vortex. The vortex now going over the mucous membrane of your sinuses releases nitric oxide. Nitric oxide is a potent vasodilator. It opens the blood vessels. It maintains your endothelial health. Endothelial health is a true sign of your whole personal approach to health. Nitric oxide is also a mediator of parasympathetic tone, including acetylcholine and cyclic GMP. Air is coming behind your throat, upper part of your lung, middle part of the lung, lower part of the lung, coming down to the level of your belly button. Here breath takes a stop. Cable kumbhak. Visualize breath is coming out. Lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, behind your nostril, coming outside your nostril. Outside the nostril, the breath picks up prana. Prana, the life force, subtle energy, which keeps us awake, alert, and alive. Breath is the carrier of the prana. Breath is not the prana. Prana is like an electricity, and breath is like an electric cable. In yogic tradition, our whole body does breathing. Prana is coming to the breath, then prana is going to the organ of healing called pranic healing. People who have a diabetes, visualize prana is coming to your pancreas. Diabetes will be under control. More relaxation response you have a activation of parasympathetic tone, you have an activation of gastrointestinal function, you have a proper digestive fire which is called Agni, and you get a proper digestion of your food, including sugar, to able to reduce the blood sugar. A relaxation response is a therapy for your diabetes. Visualize the prana going to my heart. I have the organ of healing because of the underlying heart disease. And when you are in a deep level of connecting your body and mind, you'll see your relaxation will take place. There will be no pain, no discomfort. It will be sthiram, stillness, sukham, happiness. Asana is the pose. Change your feet. Change your feet now to the opposite side and able to sit down comfortably. This activates your opposite side of the brain. Same phenomena again, touching your index finger and thumb, paying attention to your breath. When you keep on doing it for a while, your mind will be in the state of connecting what you are doing. Mindfulness is the whole body approach to health. After a prolonged practice of this, there will be no difference between the subject and the object. Non-duality. Oneness is the spiritual health, spiritual balance. When you slowly progress in your asana practice, you enter into a health. You see all the yogis, they sit down in the lotus pose. For us, we go slowly and gradually. Take our heel to the back, take our foot at the top, and put both the knees to the ground. It will touch the ground on its own. If you keep pushing it, if it is here, continue your attention to your breath, and this thing is going to happen. Also, you can do a mudra called Adhi Mudra. Thumb and then closing your hand. This is also called a Balo Mushti Mudra, a baby fist. When you do a baby fist, you become like a baby. That's the way a baby closes their fist, and babies are extremely relaxed. Every posture of the baby is a yoga asana, is a yoga pose. Balance again. Bring the other heel towards your perineum. Take the other foot on the top and let both the knees touch the ground. Yoga therapy is not putting your body in different postures in a, we call it a pretzel pose. Yoga therapy is able to connect the environment around you, macrocosm is the universe around you, and microcosm. Balance between macrocosm and microcosm is the whole personal approach to health. That is your health. Just 1 second. Bring your awareness, take your other foot on the top and able to sit down in your half lotus. You are slowly transforming into a lotus. You'll be in a lotus pose. In this lotus pose, your physical body is equally balanced by both sides of the brain. We're in a profound level of relaxation response. And slowly you enter into the mindfulness. And eventually you became the lotus. When you are in a proper health, proper meditative practice, there is no pain. Your breath is effortless. Effortless breath means you are able to talk, you are able to sing. In yogic tradition, health is completely opposite of pushing yourself to max. When you push yourself to the maximum, you create a sympathetic overdrive. When you are exercising to your best, when you're exercising, pushing yourself to the max, you are creating a sympathetic overdrive. Heart rate goes high up, blood pressure goes high up, respiratory rate goes high up, muscle is contracting, you are in a fight and flight response. Eventually, body's hemostasis, parasympathetic activation takes place, and you enter into a parasympathetic tone. In yogic tradition, you exercise almost to the half of your full functional capability. You exercise behind your breath. During exercise, you will be able to have a complete effortless breathing, breathing out longer than breathing in. And you will create a profound parasympathetic activation, which will be seen in your health tracker. Here is our health tracker. I have an Apple Watch. I wear it all the time, and I can feel. Even when I pay attention, I can feeling, in between, when I'm touching the tip of my fingers, the deep level of mindfulness and meditation, we feel the pulsation, the capillary pulsation. Our sensation starts to go down slowly and slowly. Many a time in the deep level of your mindfulness or meditation, you don't even feel you are touching both the fingers. Now, opposite side, you're doing a half lotus to the opposite side, and keeping your mind in the mindfulness, you are slowly transforming yourself into a lotus. You are entering into the state of oneness, state of non-duality, state of no separation between a subject and an object. If we do a brain scan, functional MRI at this state, we find our brain does not respond to an external stimulus. If you put a flashing light, if you put a bell or a sound, you put a perfume, it is not affecting our brain. The 5 senses do not activate the area of the brain. This is the whole personal approach to your health. If you just do a few asanas and get out, it's okay. But that is the beginning. That is the entry point of the yoga. You are entering into a house. You have to enter through the main door. You are entering into the main door. But when you are inside the house, you're enjoying the whole house. You are in the state of your oneness. And you take your other foot, bring it up. You are in a lotus pose. Whole personal approach to health is, in the lotus pose, we'll be able to sit down for a long period of time without any pain and with a effortless breathing. It's a wonderful experience. It's a wonderful experience. Keep your eyes closed. Do breathing. You feel that your whole body, mind and spirit is getting connected, getting balanced. Every union of your body, mind and spirit, you have a balance of your body, mind and spirit, which is the ultimate goal of yoga therapy practice. Roger Chikitsha, treatment of the chronic lifestyle related disorder. Chikitsha, therapy. And Shastarokha, maintenance of your health. These maintenance of the health, the daily practice of yoga. Prevents progression of the chronic lifestyle related disorders like diabetes, hypertension, coronary artery disease, dyslipidemia, truncal obesity. It may even revert the chronic lifestyle related disease. You will have a disease-free, medication-free, and a quality life. You'll be enjoying a wonderful life. Proper sign of health when you start practicing. Your heart rate will start coming down. Your resting heart rate will drop. When heart rate comes down, your body functions became less and less. Sleep. Sleep is recharging your body and mind. Sleep is like a cell phone being charged overnight. When your heart rate comes down, your resting heart rate is lower, you will see your sleep becomes into a deep sleep or deeper sleep very quickly, and you don't need that long time of sleep because you don't have too much to regain, because there was not enough function of your body and mind with a lower heart rate. Also in the lotus pose, see if you can do the opposite. Here, my right foot was first, then the left foot was in the top. Now see if I can get into left foot on the first, and then can get my right foot on the top. It's a wonderful concept. Able to do the lotus pose at both sides equally. Able to sit down. Able to do these functional asanas in stages. We are approaching the whole body's approach to health. You also can sit down in your thunderbolt pose, or hero's pose, Vajrasana. Because Vajrasana is the one which keeps your spine straight and which also a powerful relaxer of your body and mind. After paying attention to your breath, connecting your body and mind through your breath, you will be able to first do a alternate nostril breathing. In an alternate nostril breathing, you will be able to balance both sides of your brain and able to do a super brain yoga. You're sitting down in a most powerful relaxing asana or a lotus pose. And also you will notice you have a little bit of discomfort on the non-dominant side of your brain. But keep on practicing. When you keep on practicing, you will feel that you have a equal sensation in the both sides. Left hand, touch your index finger and thumb, and the right hand, close the right nostril. You don't have to close all the way through, just underneath your nostril. Breathe out your left nostril first. Breathe in through your left nostril. Close your left nostril and breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril, breathe out through your left nostril. Left nostril is controlled by your right brain. Right brain is intuitive, right brain is female, right brain is relaxing, right brain is cooling, right brain is parasympathetic. Left nostril breathing is called a moon energy, Chandra Nadi. Parasympathetic activation. Called Ida Nadi, and right nostril is called Pingala Nadi. Right nostril is controlled by the left brain. Left brain is analytical. Left brain is male, left brain is heating, left brain is sympathetic. Right nostril breathing is called your sun energy, Surya Nadi or Pingala. So two nadis or two channel comes from the root of your spine, and when it merges in the middle, it's called Sushumna Nadi. Opening the Sushumna channel is your spiritual health. Many a time you will notice that this hand became little uncomfortable when you're doing alternate nostril breathing. Initially, when we were practicing, was to put this hand on a little bit of a support, but now here, when you continue for a long time, we just use my left hand to support the right elbow and continue the alternate nostril breathing. Put your index finger and the middle finger in between eyebrows, the third eye. Bring your awareness to the third eye. Concentration in between eyebrows and third eye. Continue alternate nostril breathing. Slowly take your left hand to hold your right earlobe. This is crossing the other side of the brain, super brain yoga. And continue your alternate nostril breathing. Continue as long as you can, and continue when you have no connection with the outside world. You are totally in mindfulness and totally in oneness. That is your whole person's approach to health. Still in a lotus position, changing the side again to be in balance of both sides of the brain. After the alternate nostril breathing, the health comes from quieting down the vibrations within our brain and the whole body. Chanting is a frequency which has the same frequency as your brain and the body. When you create a vibration, two frequency interact, cancels, called harmonic resonance. Yogic tradition is called mantra. Man is the mind, tra is the container, or tra is the quieting down. Mantra quiets down the vibration of your mind and body to put your body, mind and spirit in a perfect harmony, perfect balance. For the ordinary human being like us, we start with the physical wellness, enter into a mental wellness, and then finally into spiritual wellness. For the highly spiritual people, probably they can tap into the spiritual wellness without entering into mental and physical wellness. They're always in a oneness, non-duality, and no separation between subject and object. One of this practice is called a bumblebee breathing or Bhramari Pranayam. It gives you health. It's a wonderful practice. Shut down your five senses. Five senses, the information received through your five senses is your mind. Information received in your five senses, if you put in a container, that is your mind. When this information gets processed, that is called your intellect, your buddhi. When buddhi gets more processed, then it's called your wisdom. Monomaya kosha to Vijnanomaya kosha to Anandamaya kosha. Shut down your five senses, put your index finger on your third eye, use your three fingers to close your eyes. You can also use the Shanmukhi mudra to close your senses. Use your thumb to close your ear and close your mouth. Visualize your breath. Breathe out first. Take a deep breath in and breathe out with the sound of a bumblebee. hands with pumping and cupping. Keep. Rub your hands, rub both the hands. When you feel the warmth in both the hands, if you're wearing glasses, remove your glasses. Take the hands like a cup, put it over your eyes. Let the eyes take all the heat from your hand. Eye is extension of your brain. Eye is supplied with the 4 cranial nerves. Optic nerve goes from the retina in the back. SO4, LR6, 2 muscles supplied by your cranial nerve. SO4, superior oblique with the 4th cranial nerve. LR6, lateral rectus, supplied with the 6th cranial nerve. 5th cranial nerve, the trigeminal nerve, also supplies the eyes. Ciliary muscles, when they're tight, they reduce the convexity of our lenses. We become farsighted, we cannot read the smaller prints in our books. Ciliary muscles are relaxed. The lens is a little softer. It regains its convexity. It acts like almost like a reading glass, and you'll be able to read the finer prints. Even when you develop little cataract, mild cataract, with the proper relaxation of the ciliary muscles, you are able to read without a reading glass. Massage your forehead, massage your eyes, massage your face. All the muscles here are attached to the skin. When these muscles are relaxed, all the lines in your face goes away. You don't have any more wrinkles here. You don't have the lines in your face. Take your hand, massage the earlobe. Behind your ear, in the front of your ear, inside the external ear canal, there is a branch, auricular branch of vagus nerve. It's a vagal activation, causing activation of parasympathetic tone. Bring your hand, massage both sides of the neck, massaging the carotid sinuses. Carotid sinus massage is also activation of your parasympathetic tone. We do carotid sinus massage during supraventricular tachycardia. Your heart rate comes down. Take your hand to the back, massage in the back where the muscles, trapezius and sternomastoid muscles are attached. They are also supplied with the cranial nerves. Taming the cranial nerves are like your quieting down your mind. Taming the thoracolumbar and craniosacral output. Craniosacral output, that means what comes from the cranium, that means your brain and the sacral area. Those are parasympathetic tone. Thoracodorsal, thorac means chest, dorsal in the lower part. Thoracodorsal output from the spinal cord is sympathetic. Finally, in the whole personal approach to health, we have 3 bodies. Physical body, sthula sharir. Your mind is your causal body, shukha sharir. Your spirit causal body. Through your mind is a subtle body, gross body, subtle body, and a causal body. Sthula sharir, shukha sharir, and karana sharir. In a whole personal approach to health, you will be able to visualize your subtle body, shukha sharir. Healing of the subtle body and causal body is a complete healing. Balancing the physical body, subtle body, and causal body is a whole approach to your health. When you are in a deep state of meditation, you are entering into your subtle body, you can visualize your subtle body. Gross body may be here, my subtle body may be in that yoga studio where we used to teach before pandemic. The Sattic space in Portsmouth, Virginia, I'm visualizing, I park my car, I'm entering into the door, I've been greeted by Maury Cook and also Denise and Alfred. I see all the people which I know sitting there. I'm sitting in my mat, started doing our practice and the teaching. Even when eyes closed, my subtle body, I can tap, I can take my finger, touch the tip of my nose. My eyes are closed, I'm not looking at my body. Touch the top of my head, touch the right great toe, touch the left great toe. Any part in the body. Same way, you can finish your sign of health with a alternate nostril breathing without closing your nostril, which is meditative alternate nostril breathing and staying in silence. I'll guide you one time, then we'll be in silence doing the meditative alternate nostril breathing to finish our session today, the yoga therapy whole person approach to your health. Also remember, when you are in a asana posture, if you have any symptoms, first pain, you will back off. If you get a pain, you back off. If you have any other sensation in a lotus position, a lot of people tells me we get a numbness, the sole of our foot, numbness in the foot, that is due to compression of your nerve. Also, we have a blood supply, a popliteal artery which divides the dorsal spadius artery, posterior tibial. I can feel a pulse here. Initially, when we were doing the lotus pose, many a time the pulse used to disappear. I had a flat Doppler probe. We could have put the Doppler probe here, and I'm a vascular surgeon. I could measure the pulses here in the top of my foot. So when I see that there is a reduction in the blood flow, we back off. Even now I can feel an excellent pulse here. So these are the self-assessment. These are self-realization. which you do by practicing a daily practice of yoga. Let's sit down comfortably again in lotus pose and touch your index finger and thumb. Bring your awareness in the left nostril. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. I can clearly see my air is coming through my left nostril in. Air is coming out through right nostril. Let's keep our eyes closed, spine straight in a grounding, relaxation pose, touching your index finger and thumb in silence with the alternate nostril breathing to achieve the physical wellness, mental wellness, and spiritual wellness. Oneness, non-duality, no distinction between subject and object. Slowly bring your hands in front of you. Touch your little finger and thumb. Separate your middle finger, ring finger, and index finger. Lotus mudra, Padma mudra, connecting your body, mind, and spirit. Bring the lotus mudra close to your heart. Heart is the side of your soul. You have health, physical health, mental health, spiritual health. Physical wellness, balancing both sides of the brain. Mental wellness, balancing your mind, keep it your mind in mindfulness, paying attention to every action you do, and spiritual wellness, spiritual balance, oneness, non-duality, no distinction between subject and object. Bring your hands in front of your heart chakra, put your hand, pull your head down, say namaste. I honor the divinity within you. You are divine, and that divinity between me and you brings the health. Word spirit comes from the Latin word spiritus. Spiritus means breath. We're all connected through our breath. Thank you again for joining this session that yoga therapy, the whole body's approach to your health. Wonderful session, and this will stay with us rest of the day. And again, as long as I'm here and I'm not out of town, I'll be joining you on Saturday morning for your this class. Thank you for joining. See you next Saturday.